Welcome back to the Curated Beauty Podcast. I am your host, Jessica Christie, and today we're going to dive into a powerful discussion on a topic that's been really making waves in the health and wellness space. Let's talk about semaglutide and other GLP-1 agonists for that matter. You've likely heard of it in the context of weight loss and diabetes management, especially type 2. But today we're going to explore its profound impact on multiple systems in the body beyond just talking about glucose metabolism. We will be breaking down all the findings from recent narrative studies and shedding light on how semaglutide, which is a glucagon-like peptide 1 receptor agonist, or GLP-1 RA, can transform not just our waistlines, but our overall health. I think it's time to bust the stigma around it. A lot of people are still ashamed to say that they're taking it, whether it's in a full dose, maxed out, or in a microdose form for some of the other health benefits. I'm here to bring awareness to the problem of obesity, diabetes, but also intense inflammation in the body. So let's start with the rise for just needing effective treatments. Let's start by setting the stage and talking about the prevalence of obesity and type 2 diabetes and how it's skyrocketed in recent decades. I want to give you guys some numbers. Let's talk about some of these stats that I pulled from recent studies. Now, did you know that 537 million people aged 20 to 79 have been diagnosed with diabetes by 2021. In 2030, that number is thought and projected to go up to 643 million. And by 2045, 783 million people will have been diagnosed with diabetes mellitus. When we think about how do we have this massive increase in diabetes, well, it comes from the massive increase in obesity, which comes from our sedentary lifestyle and a really unhealthy diet. The World Health Organization put out stats that obesity has tripled since 1975, and over 650 million people are classified as being obese back in 2016, which obviously we can see that has probably trended upward. And obesity has massive effects on our cardiovascular system, different cancers, lung issues, kidney, skeletal muscle, rheumatologic, dermatologic, neuropsych. So obviously it touches many different things. And obesity is connected to insulin resistance, hypertension, dyslipidemia, and systemic inflammation, you guys. So with this data, we know that we need novel therapeutic drugs that can target weight gains and metabolic effects. This is really where semaglutide enters the scene. Initially approved by the FDA for just treatment of type 2 diabetes, it's quickly garnered attention for its impressive ability to aid in weight loss. And what's truly remarkable is its potential to impact a wide range of bodily systems, making it such a game changer in the field of metabolic health. So let's talk about how this peptide works. So to understand why semaglutide is so effective, we need to look at how it works at a molecular level. Semaglutide is a GLP-1 receptor agonist, which means that it mimics the effect of naturally occurring GLP-1 hormone. This hormone is already in our body, and it plays a really crucial role in regulating glucose levels in the body by enhancing insulin secretion and by inhibiting glucagon release. But that is not where its influence stops. GLP-1 receptors are found in all these tissues throughout the body, including the pancreas, the heart, the lungs, the kidney, even found in our central nervous system. And when semaglutide activates these receptors, it sets off this cascade, and it sets off a lot of different beneficial effects, from reducing appetite to slowing gastric emptying, which some people think that is a bad thing, but what that's really doing is moderating these postprandial spikes of glucose and really improving insulin sensitivity and ultimately promoting weight loss. But the real magic lies in the broader impact on lipid metabolism, adipose tissue, and muscle health. So I do want to talk about those three things today. Let's start with the impact on lipids. One of the standout findings from one of the articles that I was reviewing on the effect of semaglutide and serum lipid levels is we know that the elevated levels of LDL cholesterol and triglycerides are major risk factors in cardiovascular disease, especially women after menopause. But what's exciting is that semaglutide is shown to significantly lower these lipids, even in patients without diabetes. And in clinical trials, patients receiving semaglutide saw a reduction in total cholesterol, LDL, which is the bad type of cholesterol in that subset, and triglycerides. And also, we saw no change in HDL, which is thought of to be as the good type of cholesterol. You guys, if you're on a statin, it's the precursor. Cholesterol is the precursor to all hormone synthesis in the body. So I really, really don't like people being on statin, not to mention that it has never, ever been proven to decrease death by cardiovascular risk. Yet many people are just shoved onto it. Okay, side note. Back to what's, really exciting about that is this could translate into a lower risk of atherosclerosis and heart disease. But what's equally important is that these benefits were observed in both injectable and oral forms of semaglutide. So we're starting to see kind of some other drugs emerge and other flexibility in treatment options for people that don't want to have a subcutaneous injection. All right, next, we're going to talk about how it's transforming adipose tissue. Let's talk about fat. That's what adipose tissue is, especially the fat that wraps around the organs. This is called visceral fat, and it's particularly dangerous because it is literally the fat that's living around organs that are trying to function, for God's sake, and it's really putting us at a huge risk for metabolic disease. And so the goal of this is reducing it and managing obesity-related health risks. Semaglutide has really shown a lot of promise where reducing visceral fat, including the EAT, epicardial adipose tissue, this is what's going to surround the heart. This reduction not only helps in weight management, but it lowers the risk of cardiovascular complications. And what's really fascinating about that is semaglutide doesn't just reduce fat, it improves the function of the remaining adipose tissue. The therapy shown to decrease the expression of pro-inflammatory genes and reduction in the endoplasmic reticulum stress and adipocytes, which are fat cells. This has led to an overall metabolism and function of fat cells, making the body's energy much more, that whole system and that whole management much more efficient. Something interesting is when we talk about the different types of fat, have you heard of brown fat and white fat? The interesting thing is adipose tissue stem cell proliferation activity had gone up after semaglutide compared to type 2 diabetes that's impaired in type 2 diabetes patients. And so it made me even think about, all the fat grafting that's going on in the aesthetic world. Should these people be on a course of semaglutide prior to fat graft harvesting, because their stem cell proliferation activity went up. And so that's going to be healthier type of fat. And semaglutide users, they consume glucose more efficiently and they use it for more ATP synthesis as well. So super important kind of stuff. All right, let's talk about skeletal muscle and preserving muscle mass and function, because that's a big key thing that people always want to talk about, that semaglutide is going to decrease muscle mass. It does not decrease muscle mass. What decreases muscle mass is people going on anything and starving themselves and going into a catabolic state where they are losing their muscle mass. So one of the biggest challenges in weight loss is the tendency to lose muscle mass with fat loss. Obviously, this is not a new concept. Muscle is critical for maintaining metabolic health, and losing muscle can lead to a whole host of problems, including insulin resistance and decreased physical function. And here's why semaglutide really shines, guys. Unlike many weight loss treatments that lead to muscle loss, semaglutide has actually been shown to preserve and in some cases even enhance muscle mass and the function. So in studies, patients treated with semaglutide saw improvement of muscle metabolism, increased blood flow to muscle tissues, reduced markers of muscle atrophy. This is so important for older people with chronic conditions, where maintaining muscle mass is crucial for overall health and mobility. If you're going to go on a dose unmonitored by an uneducated provider that can and will prescribe you these medications without the careful, thoughtful counseling about what goes into them, yeah, you can get on too high of a dose. You won't even be able to look at food. You put yourself into a complete anorexic state, and you will lose fat and you will lose muscle. That's absolutely possible. Same way as if you just stopped eating and you went on some crash diet, you're going to lose muscle too. But this is actually, done correctly, a protective measure to keep and maintain your muscle mass and function. So the next part that I want to talk about before we conclude is a holistic health solution. Semaglutide is truly a holistic health solution. And what we are seeing with semaglutide, it's a therapy that offers just that, a holistic approach to our health. And it's addressing not just one aspect of our metabolic syndrome, but multiple interconnected systems. So by improving lipid profiles, by reducing harmful types of fat, by preserving the muscle mass, these GLP-1 agonists are going beyond just managing blood sugar. It's offering a comprehensive solution that can significantly reduce the risk of other long-term health implications that are associated with obesity. However, it's important to note that while the results are very promising, obviously many of these studies have been conducted on relatively small patient groups, and more studies will roll out. You can bet your bottom dollar I'm going to read them. More research is needed to fully understand the long-term effects of the potential of all the things that these medications can do and these peptides can do. But based on what we know so far, it's so clear that these peptides are a powerful tool in the fight against metabolic syndromes and disorders that can really plague modern society. So I will just conclude with saying semaglutide represents a new frontier in the management of metabolic health, with benefits that extend far beyond just glucose control, like we've talked about today. And as more studies emerge, it's likely that we're going to see not things that we realize are bad about semaglutide, but a broader application of this therapy. For anyone dealing with challenges with obesity, type 2 diabetes, or just feeling like they're in metabolic dysfunction, even from a gut standpoint, semaglutide could really truly be a key to unlocking better health and a higher quality of health. So thank you for tuning in today to the Curated Beauty Podcast. If you found this discussion insightful, please be sure to subscribe and leave a review. And as always, if you're ready to take the next step in your wellness journey, don't hesitate to reach out to our team at Beauty Culture Med Spa Cultured Wellness. Until next time, take care of your body from the inside out.